The death toll from the West Africa outbreak of Ebola has topped 700. The World Health Organization Thursday announced dozens of new fatalities.
It's very concerning that we're seeing this kind of geographical spread of the disease.
U.S. health officials are now warning Americans not to travel to 3 West African countries. Ebola cases first emerged in Guinea back in March and later spread across the borders to Liberia and Sierra Leone. The outbreak is now the largest recorded in world history. It's prompted the U.S. Peace Corps to evacuate its volunteers from Guinea. The State Department says 2 Peace Corps workers are under isolation outside the U.S. after being in contact with a person who later died of the Ebola virus. The virus has no vaccine, no specific treatment, and has a fatality rate of at least 60%. The Centers for Disease Control and Prevention, the CDC, says the risk of the deadly virus coming to the U.S. remains small.
The CDC has concluded that there is no significant risk in the United States from the current Ebola outbreak. And while it is unlikely that the disease would spread if the virus were detected in the United States, the CDC is taking action to alert healthcare workers in the U.S. and remind them how to isolate and test suspected patients while following strict infection control procedures.
And options to help 2 sick Americans currently being hospitalized with Ebola in Liberia are being weighed.
The State Department and the CDC are working to facilitate options for potential medevacs for U.S. patients, specifically American citizen humanitarian workers.
The CDC has about 24 staffers in West Africa to try and help control the outbreak and plans to send 50 more in the next month. Tracy Brown, Associated Press.